I'm ready when you
Alzheimer's
are.
and dementia. So dementia is kind of the umbrella. And there's other, things are called dementia. It seems to be the kind of topical word, and there are other conditions then that come under that. One of them is Alzheimer's. But there's other forms of dementia. There's also Lewy bodies dementia that comes with Parkinson's.
How did they diagnose that since they can't do a brain biopsy on the Lewy?
How did they diagnose Alzheimer's?
No, Lewy body.
Lewy bodies. It kind of comes along at the later stages of Parkinson's. It's it's connected to Parkinson's. Lewy bodies isn't freestanding. You know, you're not going to not have Parkinson's and have Lewy bodies. You will have Parkinson's. And then it comes along with, because Parkinson's is also one of the neurodegenerative diseases affecting the brain. Normal aging, slower recall, or we forget part of an event, you know, just slower, like, oh, I can't remember, oh yeah, now I remember, that kind of a thing. Able to follow spoken and written instructions. That is normal aging. You may forget stuff, but you can follow spoken and written instructions, and they make sense to you. Some difficulty concentrating, we're acquiring less distractions and noise. You might find if you're reading a book or you're reading the paper, 20 or 30 years ago, there could be noise going on in the background and you're fine. Now you're kind of, oh, let me go somewhere quiet. The capacity to learn stays intact, okay? So you can learn throughout all of life, okay? In normal aging. The information might take longer for you to absorb it, especially if it's new information, but you can learn it. It just will take longer to absorb, but it's not something you can't do, and that's significant. It is normal aging, but you still keep that capacity to learn. I personally experienced this more recently. Don't ask me why I did this. So I'm an RN, I have a bachelor's degree. I have my own home care agency. I decided I was going to go back to school, and I was doing a master's in nursing. So that was fine. The classes were fine. Basic, you know, the first 4 or 5 classes were fine. Then we came to advanced pathophysiology, advanced pharmacology. I worked up here at the hospital, at Christ Hospital, for a long time. I was a house supervisor at the hospital. I moved into the clinics, Advocate Medical Group clinics. I managed some of the surgical clinics. And I have been essentially kind of stepped back a little bit from the actual bedside for a while. Advanced pathophysiology, I had started this business in home care already. Okay, advanced pathophysiology came around. Oh, sweet Lord. I could have spent 24 hours out of every single day studying.
Yeah.
And I still don't think it would have done it properly. But I came out of the class, I ended up with a lower A in the class, so I was happy. Then I went into advanced pharmacology.
Oh, boy.
Oh my, I couldn't even, and I've been a nurse for about 40 years. I couldn't even say the name of the medication. The generic names. I could hardly even pronounce them.
Yeah.
But I hadn't been using the medications for a while, so that was kind of my excuse. I had to drop it. Week 9, I thought, because I was running a business as well.
Yeah.
Week 9, I thought, this is ridiculous. This is never going to work for me. So I ended up going into a business major.
Yeah.
But I definitely experienced that slower absorption of information. I didn't think I would, you know, but I did. And it's frustrating, especially with new information. Information that you already kind of know and you're, reviewing per se, but you have the basics of it. But new information was just, it was a chore. I couldn't, I was getting up I was waking up in the middle of the night thinking, oh, I have to do that paper. I have to get that done by this time. It's terrible. Specific diseases can cause dementia. This is the umbrella. One of them is Alzheimer's disease. Okay, Alzheimer's disease does cause dementia, and that's a lot of times how we see it. But there are other diseases that cause dementia. Lewy bodies is one. If an older person has a urinary tract infection or an upper respiratory infection, they can get a period of dementia with that. A lot of times they may have, you might find that somebody all of a shot is confused. I've been never confused before. Almost always it's a UTI, a urinary tract infection. And it goes away once they start having antibiotics, but that's often how it can present in an older person. A younger person, they might have the stinging pain, they may have other things. One of the things with the urinary tract infection is going to the bathroom often and only doing small amounts. But with an older person, it can present as confusion, what looks like dementia. Another one that can cause dementia is a major surgery where somebody would have got an anesthetic in an older person. That can cause dementia. It's transient, it comes and goes. It may last for a couple of days after the surgery, but it will go away. The other one is a change in location, especially in the older adult, the older elderly, the people up around 85, 80s, 85. A change of location you might find where somebody is living at home and they move to another facility, or they move to assisted living, or they move somewhere, move in with their daughter, move in with their son, and they're confused, but they weren't confused before that. It will go away, but it can happen, and it happens very frequently. Or if somebody moves into a nursing home or assisted living and you find out, oh my God, they're confused now, they were never like that before, it will go away. Someone develops Alzheimer's disease every 65 seconds in the US. Every 65 seconds, somebody is being diagnosed with Alzheimer's. It's the 6th leading cause of death in the US. The age at onset is almost always over the age of 65. Although it has been argued that some younger people can get it. Now, I say over the age of 65, it's presenting. It may have been there before that, but when it presents, it's over the age of 65. The incidence increases by a lot with age as people continue to age. So incidence and prevalence are different things. Incidence is the number of events that happen, okay? The prevalence is the number that happen in the whole population. More than 5.8 million Americans are currently affected. And of that number, 3.2 are women, 3.2 million. Inherited Alzheimer's disease is rare. Although you may have somebody that has Alzheimer's disease, you may know somebody and their father had it, or their mother had it, or their aunt had it, but it isn't inherited. That's just coincidental, that because you're looking at every 65 seconds. There are huge numbers. The World Health Organization is zoning in on it because they're the 6th leading cause of death, and you're looking at heart disease, strokes, cancer, and you have this down at 6th. less than 1%, and they usually occur before 65 years of age if it's inherited. You see it in kind of younger people in their late 40s. 10 most and least affected countries, and we really don't know why. Nothing research concrete to say why. Finland, United States, Canada, Iceland, developed countries with healthcare systems in place. And then we have India, Cambodia, Georgia, and Singapore are the 4 least affected countries, which is interesting. So different forms of dementia are linked to changes in the brain. Alzheimer's disease causes parts of the brain to shrink. And what you see on a CAT scan or an MRI is shrinking of parts of the brain and bigger gaps in here. You see where these lines are? You get wider gaps because it has shrunk, and while it's shrinking, the gaps are wider. Parkinson's damages the brain that's involved in movement. Parkinson's, you see that rigid movement with Parkinson's, and if you know anyone with Parkinson's, you see them when they walk with a walker, they shuffle, which is something that they really, you try to cue that they have somebody walk beside them and tell them to lift their legs, you know, and walk, because that shuffling causes injury, they'll fall. Vascular dementia happens from blood vessels that supply the brain are diseased or clots or have little small plaque in them. So there's different kinds of dementia. One of them is Alzheimer's disease.
Is what?
Different kinds of dementia. One of them is Alzheimer's. Riceberg stages. This is a doctor that developed this scale. I think he was out of one of the New York hospitals. It was some time ago that it was developed. It's a global deterioration scale. Megan will have this, if anybody wants to get this flyer, this from her, okay, I'll send it to you. There's 2 on this that I'll send you.
Okay.
No cognitive decline, no complaints of memory problems, no evidence of cognitive deficits. So there's no visible cognitive decline, but somebody could still have Alzheimer's, but they're not presenting with anything. Okay, so it's like you can have a disease process going on, but you're not presenting with it. So like, for instance, say somebody comes to the emergency room, they're almost always presenting with something, coming in with a severe headache. It could be high blood pressure. It doesn't mean that the high blood pressure started that day. It just means that it became symptomatic. Okay. Very mild cognitive decline, reports of memory problems, problems like misplacing objects or forgetting names. Now remember, we're not talking about normal aging here. We're talking about a stage of Alzheimer's, and it will progress through the 7 stages. Normal aging, we can be forgetful, but that's not what we're talking about here. No evidence of issues with work or social situations, okay? Forgetful, misplacing things, but still functioning. Mild cognitive decline is impaired concentration. Again, not talking about regular aging, okay? Difficulty with work tasks, some denial and anxiety about deficits. What you'll find sometimes is somebody that does have impaired memory, difficulty with tasks, things that they would always have done. Things like putting the kettle on, making coffee, problems with those sort of things that were always functioning and they were always able to do. Simple tasks. some denial and anxiety. So they're aware of the deficit. They're aware that they can't remember. What people will do sometimes is what they call confabulate. So they will kind of make up a story around it to cover up the deficit. Okay. Moderate cognitive decline, trouble remembering personal history. Remembering, I had an aunt who passed away from Alzheimer's, and my mother's sister and another sister of theirs had died. And afterwards, back in the house after the funeral, my aunt said to my mother, my aunt that died was called Kay. My aunt said to my mother, "Oh, what was Kay to you?" She was their sister. You know, that's kind of personal history. Trouble traveling or handling finances, definitely trouble handling finances. Traveling, just forgetting where they are. You know, I'm not talking about traveling out of the country or traveling to another state, just generally forgetting where they are. You hear of people that have left the house in a car and they can't find their way home. Reduced expression of emotions. So kind of a blank expression, not able to, just not experiencing the emotion either. Okay. And withdraw from situations that are challenging. Again, it kind of plays into that denial and anxiety and confabulation, where instead of having to deal with situations that they don't remember dealing with, they withdraw from them. They're still capable of knowing that there's a problem, so they'll just withdraw. Depression is another thing that can go along with Alzheimer's. Moderate to severe cognitive decline, some assistance is needed, evidence of short-term memory loss, lack of orientation to time, place, or date. They don't know what time it is. They know it's daytime maybe because of light outside, but they really don't know if it's morning, afternoon, or late afternoon. Place, again, that kind of plays in a little bit to the travel. Once they've moved from one location to another, there's a disorientation, or the date, whether it's you it is often. May need assistance choosing what to wear and assistance knowing to change their clothes. Lack of, and the sixth stage here, lack of awareness of recent activities of daily living may require assistance. And that's where this comes in, around that stage of severe cognitive decline. Knowing to have a shower, how to turn the shower off, how to change your clothes, that you would be changing your clothes, where the clothes are. Incontinence and or bowel issues may happen around this sixth stage as well. They may become incontinent. Sleep disturbances, more than likely waking up in the middle of the night, waking up halfway through the morning, like 3 o'clock in the morning. Not being able to fall asleep. Personality and behavior changes, including hallucinations, anxiety, agitation, and obsessive behavior. Obsessive behavior is if I was fixing these things constantly, you know, putting things together, that kind of washing your hands, and then you're washing your hands and it's done, and then 5 minutes later washing your hands again and like scrubbing, that kind of obsessive behavior. Personality changes, behavior changes. Some people may be combative, they may not be, but you have to remember, if you're caring for somebody with Alzheimer's, it's the disease. It's not the person that you know or the person that you knew. The personality change is the disease process, you know, and it can be very frustrating taking care of a client or a patient with Alzheimer's. There are tools you can use, you know, if they become they can become very determined to do one thing. You know, kind of you go with it, but if you distract, you can easily take them away from that. If you distract with something else, like I have had clients, and in the past I've also had patients, where they want to go here, right? They want to go somewhere, they want to go down to the kitchen. You can walk along with them and chat, and by the time you get towards the kitchen, they've forgotten about it anyway, and they'll turn around and go back, or it's easy to distract them. And personality and behavior, significant personality and behavior changes. I've heard the disease called the long goodbye, which I think is, and I've also heard it called the lonely disease. Lonely for the people that don't have Alzheimer's, because you kind of lost the person that you knew. Difficulty moving, eating and swallowing, loss of speech and ability to hold a conversation. Not able to hold a conversation. Loss of speech is where you will find gibberish, saying words that don't mean anything, and not even forming full sentences. Loss of bladder and bowel, definitely incontinent at stage 7. And again, unable to do daily activities without assistance. Swallowing, moving, difficulty moving, eating and swallowing. You need to watch for, if they have difficulty swallowing, speech therapy is speech therapy that does the test. They do a swallow test. And because they can aspirate. When you aspirate, that means that the food goes into your lung, not into your. So you've got the esophagus and you've got the windpipe here, what we would call the windpipe, the trachea. And when they swallow, bits of food can go into the trachea and down into the lung, which will give you bronchopneumonia. And they can often die. People can die from bronchopneumonia. The other, what you can add to clear liquids, or like water, they shouldn't be drinking water without a thicken added into it. To thicken it up where it's almost like a thick soup, because they still have that gulping action, but not thin liquids. You can get aspirate pneumonia from that. Loss of memory of recent events. These are just the basic characteristics. Impaired executive function, that's judgment, problem solving, finances, driving, all of those things you need executive judgment for, executive function for. Behavioral symptoms, apathy, social disengagement, that withdrawal, irritability. Another thing that goes along with behavioral is depression. Sleep disturbance, seizures in only about 10 to 20% of cases. Seizures, remember, we're talking about brain damage that's causing this Alzheimer's presentation. So seizures can go along with that, depending on where the damage is most effective. And by stage 7, it has affected the whole brain. But we still only see seizures in about 10 to 20% of cases. Difficulty performing motor tasks, and that usually, motor tasks are things like picking the pen up, you know, picking something up, what you do with your fingers, you know, that kind of thing. This is executive function, flexible thinking, adjusting behavior to unexpected changes. They're not able to do executive functioning. Keeping information in mind. Will you keep key information in mind when using it? So key information, where's the bank? Where's their checkbook? How do they write a check? They have no self-awareness or how they're doing in the moment, okay? Impulse control, you know, thinking before you act to do something, that's gone, that control is gone. Keeping track of things physically and mentally. Again, we talked about not knowing where clothes are, not knowing how to put them on, not knowing that you should change your clothes, taking action to get tasks started so they won't initiate something, they're not able, and setting and meeting goals, prioritizing and planning. They are all executive functions. The progress can be measured with instruments. So it can be diagnosed with like MRIs, CAT scans of the brain. It would come under the umbrella of neurology, but primary care doctors will look after Alzheimer's clients as well. But the kind of initial diagnosis for the most part comes under the auspice of neurology. These are mini mental state exam. It's just a scale that the doctor would use to measure cognitive changes. Montreal Cognitive Assessment and the Clinical Demand Rating. This here is, you see this, who am I? Alzheimer's disease patients will get to a stage where they don't recognize themselves as being themselves in the mirror. They don't know who's looking back at them in the mirror. Another thing that we've seen is people that are married, they won't recognize their spouse as being their spouse. They'll think they're living with a strange man or a strange woman. But yet if you show them a photograph of 50 years before, when they were 60 years before, they recognize the younger person as being their spouse. Clinical dementia rating, I'm going to give this to Megan and she'll be able to give it to you, or either email it out to you if you have an email, or pick one up here at the library. So this is a scale that they use, again, very similar to the other scale, the 7 stages that we talked about: memory, orientation, judgment on problems, community affairs, home and hobbies, personal care. There is a number given to each of them, and the score would be a number depending on the stage of Alzheimer's that they're at. So no deficits here, no memory loss. Slight inconsistent forgetfulness, that's normal aging, okay? It's not consistent all the time. Fully oriented, as opposed to, say, moderate difficulty with time, oriented to place at examination, but may have geographic disorientation. So they might say, yes, I know I'm in the doctor's office, and you ask them what city you're in, and they don't know what city. They will say something at that stage because they're trying to cover it up. Okay. Later stages, they don't, their brain has deteriorated where they don't know to cover it up, you know. So this, I won't go through this because this Megan will send out to you. No cure. Medications can be ordered by the primary care doctor or the neurologist. Aricept, I know, is one medication that people are on. What it's not going to get rid of the disease, it's an attempt to try and slow the progression of the disease. And it works with some people, it doesn't work with other people. You know, it's like all medication. Remember about medications, there's 2 sides to medications, any medication. How the medication reacts to you, we're all individuals. We all have different faces. All of our bodies are the same, but they're different. The way our faces are the same, but they're different. How you react to the medication and how the medication reacts to you is, you know, and no 2 people are the same. So something like Aricept might work really good for one person and not so much for another. And the research, although there's been an awful lot of research into Alzheimer's, it's still not where we can say, yes, this works for this type of person or something else works for someone else. Hyperbaric oxygen therapy, they've used that on some people, where you go into a kind of it's almost like a big BiPAP machine with a mask, and they blow high concentrations of oxygen in. And yeah, it works in slowing the progression for some people. Because remember, oxygen to the brain, we all have to have oxygen go to our brain. So when you get deterioration of the brain and you get those gaps, you're not going to have as much oxygen. The brain is shrinking, so you don't have as much oxygen go to the brain. Craniosacral therapy is kind of a massage therapy that they do from the head all down the whole lumbar region. They're all kind of shots in the dark, really. Vaccination is being researched, but it's just being researched.
What do they vaccinate against? What do they use as a model?
I don't know. It's literally in the stages, but it's not close. It's not close to being developed.
Do you think there will ever be a medication that can?
I hope so. I hope so.
Working very hard on it.
They're working hard on it, yeah.
Very hard. I mean, if you go to see, a lot of things are going on for them.
Yeah.
But according to me, I think it's something that has to do with the sleep also a lot. If you get enough sleep and rest, you are different that day.
Yeah, but we're talking about normal aging. This is not normal aging. This is a disease process. So
I look at it this way, the brain is more alert. Anyone, even dementia or anything, is more alert when they have enough rest and sleep.
I know, but yeah, and I understand what you're saying, but look at it as the way it crosses all social classes, all racial classes, all religions, all behaviors, all lifestyle change, all lifestyle habits. It actually, sometimes like alcoholism is a disease. How the person behaves, how an alcoholic behaves is a disease. And that's another one that crosses all everything, all social classes.
So they can only diagnose by behavior
And they can examine the brain from the radiological aspect, like CAT scans or MRIs. Yeah, and how it presents, but it will go through those 7 stages. Some people don't live long enough to get through all 7 stages. But remember, so it's a deterioration of the brain. So it's going to affect every single thing in the body. All movement, all eating, swallowing.
Well, they're now saying hearing is causing it. Because it doesn't activate the brain.
that's I have heard that too.
Yeah.
Hearing.
Hearing.
Yeah.
If they start when they were not hearing and now when you put the hearing aid, there is a difference, somewhat difference, not a whole lot different, but there is a difference. They have noticed.
Hearing and visual and hearing changes can affect it too, because if you can't see and you can't hear, whatever confusion is there is going to be worse.
Right.
But as a cause,
Not the cause, but they say it helps them.
it does
also.
help. It's important that people realize that for all older people that need glasses or need hearing aids to get them,
Mhm.
or but for Alzheimer's especially. Cause and cure is
Not yet.
battling everybody. And then they've said, keeping your brain active. The people that have kept their brain active have got it as well.
Yeah. Is it like senility that, like they always said my grandma was senile?
Yeah, we used to use that term years ago.
Okay,
And yes, it's, yeah, it can look like that, but that doesn't mean that every person that was senile had dementia, had Alzheimer's. Because they did have the senile, but maybe it never progressed. You know, it will progress through those 7 stages because of the deterioration of the brain. And that's why swallowing, speech, all those things are brain functions. Pseudodementias are reversible. Okay, so they are drug reactions. Somebody's on a medication and it makes them confused, or it looks like they have dementia. If somebody starts on a new medication, that would be your first question. Oh, I wonder, is this doing that? Emotional disorders is another one that can cause confusion, dementia, confusion, similarity. And they are all reversible. The drug can be stopped, another medication given, they're fine. Emotional disorders, depression, somebody has bipolar, as they're aging, they've been on medication all along, as they're aging, that medication doesn't work anymore and they may need to be switched. It can be reversed. Metabolic and endocrine disorders, again, can be reversed. Endocrine things like thyroid, problems with the thyroid sometimes can cause some dementia in older people. Metabolic, high sugars, low sugars, you know, diabetes with in older adults with higher low sugars can look like that. Eyes and ears, sensory loss. We talked about that with hearing and vision, but that can be corrected.
What about hepatic encephalopathy?
That's different. I'll talk about that in a minute. Nutritional and electrolyte imbalances, things like potassium, you know, high potassium, low sodium, high sodium, those sort of things can cause, but they're easily corrected. Nutritional dehydration in an older person can cause confusion. Tumors, brain tumors or tumors elsewhere, cancer in general in the body can cause that. Infection, we talked about that with the urinary infection and upper respiratory infection. Somebody can appear to be really confused with a urinary tract infection, an older person, and as soon as you start that antibiotic, it goes away. Like it goes as quick as it came. Arteriosclerosis, congestive heart failure type of things. Remember, arteriosclerosis, while it is in the heart, can also be in all the vessels. Hepatic encephalopathy, yes. The hepatic is the liver. Encephalopathy is that can cause confusion. It depends. If they can give medication to correct the hepatic disorder, the encephalopathy may go away as well, or it may not.
So it might be reversible, maybe in the
It
early
might be.
stages.
Yeah. The other one is alcoholic encephalopathy. That's another one, you know. But usually the damage is done to the brain by the time they get the encephalopathy. But it might look like the confusion and all of that, but it won't progress through those 7 stages. That's what it will look like. The encephalopathy may cause the confusion and it might get worse, but it isn't Alzheimer's. The Alzheimer's will go through those stages.
So is it technically a dementia or no?
It looks like it is, but it really, it's a liver issue.
Mm-hmm.
It's a liver because the liver metabolizes a lot of things that we take in, medications especially, and it's really the toxins, you know, things that metabolize. And if the liver isn't working, toxins can build up and that then causes the Alzheimer.
I have one question. So with dementia and Alzheimer's, when these people know now they should not be driving because
Wait now, these people don't know that they shouldn't be driving. You know they shouldn't be driving, but they don't know. Yeah, because they'll go out, somebody with Alzheimer's that's confused will go into the car and try to, some may go in there and not know how to drive the car. Others will drive and it's very dependent on the stage that they're at. Others will drive and they get lost. They don't know where they're going. But they don't know that they can't drive.
Do some of them become violent?
Yes, they can do. Yeah, they
that's
can.
that's a problem I have at home. My husband, he wants to drive. And I know he's forgetting things. And he's just arguing with me.
When it gets to things like safety, because he could
Be something.
be in an accident.
I mean,
And does he have Alzheimer's?
he doesn't have it, but I can see he started
Start.
having forgetful moments,
Yeah.
So I'm thinking like,
And you don't
you
feel
are
that he's
somewhere
safe
and
driving.
then you forget how to come back.
Yeah.
I mean, at the minute, he's okay, but it's coming.
Yeah.
I can see it. I'm having a very hard time.
Yeah.
They tell me to take this battery out of the car.
Yeah.
So he tries and it doesn't work.
Yeah.
That's what I'm afraid to take the battery out.
Then
Hide
he
the
gets
keys.
really violent.
I know he is. He's
Right.
getting there.
You have to be very careful.
Yeah, and maybe get some medication for him. Is he on medication?
No, he hates medication. He
Yeah,
takes
I know.
very little medications as much as possible. He's not the guy who will take medicine.
So even if the doctor gave him some